We're going to talk about CAD RADS 2.0. 2.0 is the newest version of CAD RADS published in 2022, and that's what we're currently using for qualitative and quantitative assessment when we're reporting. So some common abbreviations, these are not going to be new to most people. I'll leave them there so you can look at them at your own time. So we talked about earlier with Dr. Garcia about patient selection, and we already know that we are class 1 for intermediate risk acute chest patients or patients with stable symptoms and intermediate high pretest probability. So CAD RADS here on the very left, 0 to 5, 0 being normal, no visible stenosis, and that's to the human naked eye, because we'll talk about why that now is a little bit different. And 1 to 24%, so that's considered minimal stenosis. 25 to 45 is mild stenosis. 50 to 60, CAD RADS 3 and above, that's when we start thinking about additional method of making a diagnosis. And so that's going to include your moderate, your severe, or 5 being your CTO, which we have seen one today. The second part of the CAD RADS classification is now going to tell us about plaque burden. And the amount of coronary plaque by CT has a strong association with the incidence of coronary artery disease events. And those why it was incorporated to aid in the anatomical and clinical parts of the variables. So P1 is going to be minimum amount of plaque, and I'm going to explain this in detail in a second. Moderate, severe, extensive. So that's going to be 4 classifications. So we have 5 for CAD RADS, 4 for plaque. Mild is going to be, there's going to be different methods, and actually the guidelines, the reporting guidelines say you should use what is more available and more used at your institution so that you can have your own reproducibility. So plaque can be quantified by calcium score. So 1 to 100 is going to be mild, up to 300 moderate, up to 999 severe, and then extensive, anything above 1,000. Then the segment plaque is going to be based on assigning each of the 16 AHA segments of the coronary arteries, 1 for plaque presence. So the maximum there's going to be 16, assuming that you have plaque in every single one of your segments in the coronaries, where the extensive is going to be more than 8. So anything more than 8 is P4. And then your mild is going to be 2 or less segments. And then visually, that also comes a little bit with variability, obviously, from reader to reader, but it's going to be 1 to 2 vessels for for P1 and 2, and then 3 vessels or 1 with severe for P3, 2 to 3 for extensive. So this is just sort of like, you just kind of have to keep looking at this, because unless you've done hundreds and hundreds, you won't remember the exact number. So most reporting systems will have a template there where you can go ahead and say. CAD RADS has also a modifier. So N, that's going to be for your non-diagnostic study. So if you have lots of motion artifact and you cannot clear a segment, you're just going to designate as N. Presence of stents, presence of grafts. High-risk plaque was previously denominated as vulnerable plaque, and the definition there is 2 or more of the 4 high-risk things. So what are those? The spotty calcification, low attenuation, which is going to be less than 30 Hounsfield units, positive remodeling, or a napkin ring sign. So if you have 2 or more, then you have to call the high-risk plaque, and that has to be reported. And in this new or newer now version, we have 2 modifiers for ischemia, and that can be determined by either CT FFR or CT perfusion. And then exceptions. So the case that we just did is going to be CAD RADS 0E, because exceptions, so fistulas, dissections, anomalies, they're all going to be under E. So grading the scale of ischemia, so this is very straightforward. Unlike everything else, this is the most straightforward thing. So positive, negative, or borderline ischemia on FFR or perfusion.